If you're thinking about starting a therapy group and one of your main questions is, how do I know that this person is actually a great fit for the therapy? Better yet, how can I figure this out before they actually enter into the group? This episode is for you. And so therapy groups do not fall apart because you're not good at what you do. Therapy groups actually fall apart because we don't curate a space with the right people in a room together. So let's go ahead and talk about therapy groups and choosing the right fits. Hey, Grateful Day. Welcome back to the podcast. This is Dr. TK, clinical psychologist and therapist business coach, also known as your scale coach. And so we are going to continue talking about moving from one-to-one to one-to-many, doing it in a non-complicated manner, and it feels seamless, and it is, of course, ethical. And so before I go into any teaching component, I always like to tackle your mindset first, because if we don't think about how expansive we can be with our already existing knowledge, we are in a lot of trouble as therapists, okay? So I like to call this like the reframe section. And so think about it. You already know how to do a clinical intake, which means that outside of maybe a separate set of questions that, of course, should be curated for those who are doing a group in a shared space, you already know how to collect information from people. You already know how to also assess for history, background information, symptomology, and also clearly understand diagnoses. But when you think again about putting people in a room together, whether it's a virtual room or an in-person room, there should be a new level of additional discernment, which means that you want to take a step back. You really want to ask yourself, is this person going to go well with the goal of this therapy group? Can they take advantage of shared space? And can I trust that I'm going to select the right people in this group so that they can grow with one another? But this does not require you to have additional credentials. You already have the clinical expertise. And so the goal about therapy groups really is not to decide whether someone needs therapy, okay? The goal is to determine if group therapy is the right type of therapy that this person would benefit from right now. So first, let's talk about assessing the readiness for a shared space. So when you imagine going into a virtual or physical therapy group space, the work does not happen in isolation like it does in one-on-one therapy. So you're not just asking, can I treat this one person? You are actually asking, can this person engage safely and productively in a shared therapeutic group environment? And that does require you to assess during the intake process their readiness that is different from individual therapy. Now, another thing that you want to consider is that you are assessing capacity, not just need. And so someone can actually get support with individual therapy, group therapy, or a blend of the two. But you still have to decide, are they a good fit for the goal of this actual therapy group? And so it's not about excluding people like, oh my gosh, I don't want to say that they are not or they cannot meet the criteria of the group, but it's more about clinical appropriateness, meaning what are they going to get out of the group and can they show up as their best selves? Again, I'm going to emphasize again in a shared space, okay? A group is not the place to figure out clinical foundational stability, meaning you don't know what's walking into the room. Now, something else that you are actually assessing when you are deciding if somebody is a great fit is their ability to align with the actual group's purpose, the goals. When you sit down and think about your curriculum, your process for the therapy group, and you imagine the end goal, which I hope that you are, what do you see those individuals doing in session? And can this individual do that? What is the goal once they leave the therapy group and they take everything you've taught them and that they've talked about into their real life? What does that look like? And you want to consider that picture when you are actually talking to each individual to see if they're a good fit for your therapy group. So remember, as a licensed provider, your role is to protect the integrity of the actual container of the group, okay? So you want to make sure that when people are coming in, that they will fit in with the goal and with other members in the group. So during the intake process, you're not just screening the individual, you are actually screening the alignment with the group's pace, meaning can they actually talk about these topics in the increment of time that you have given them, such as 8 weeks, once a week? Do they agree upon, when you talk to them about the therapy group, the structure? With structure, there can be various types of groups. So let me just insert this here. One, on the onset, you want to decide if it is a open group or a closed group. The difference is an open group is continuous enrollment. So think about your AA groups, your NA groups at community clinics, some domestic violence groups that are at a community clinic. They are just ongoing. People get screened and they know that people have been in there for certain lengths of time. A closed group is, it starts on February 1st. The group ends on March 31st. It runs for 8 weeks every Monday at 4 p.m. Pacific Standard Time. Okay. That's a closed group. Now, when it comes down to the type of group, you can choose usually out of 3 different types. So you can do a very structured curriculum-based group in which they're following like a book or a guide or activities with some discussion. You can also have a process-oriented group. Now, be very mindful of this in the screening process, because this is why you want to know somebody's background, because when there is no curriculum attached and you bring in a topic just for us to talk, let's just say if I'm a group member, you really want to have the background of each individual member. Then there is what I call the blended effect. And so this is where you have curriculum plus process. Now, I love the blended format because you are coming in each week teaching a very simplified topic for like 5 to 10 minutes. Then we're going to talk about it. When I've done therapy groups with teens, we can do role plays, we can have a lot of fun. But these are all the things that you want to consider when you are choosing someone to be part of your therapy group. So that also brings me to the screening questions. When you do your intake, you will have your typical questions around their background of whatever you choose to have in your clinical practice, or maybe even if you're developing a group at a job. However, when you are screening people to be in that shared space, you should have a additional set of questions that are directly related to the topic of the group, the outcome of the group, and the process of the group. And so your regular intake is going to take you through your regular process. But if your regular intake questions for the therapy group do not tell you at the end if the person will be appropriate for the group, then I would highly recommend that you check out my description box. This is the very reason as to why I created the therapy group starter kit, so that you can know the intake questions to be added to your intake process, but also you can know the checks and balances related to the systems so that you will know the onboarding, treatment, and then offboarding process run smoothly. So check that out in the description box. So at the end of the day, this is why screening matters. This is why specificity with what you're doing in your group matters, because we do not want to overcomplicate things. Just remember that systems for starting something, especially when it is new, it is helping your clients have a seamless process. It is protecting and saving you and your clients time, energy, and it protects the integrity of the group. So remember this, when you start a therapy group, the process actually starts before the first session of the group. It starts with your clarity. It starts with intention of why you want to do the group. What are people going to get out of the group? And you want to consider the thoughtfulness that you put into the process that will support not just the problem that you're solving, not just so that people can finish your 8-week process, but it will support the individuals that are going through that process in the group. And so listen, if you're really curious about how therapy groups can truly save you time on your calendar and you can generate at least $350 an hour for therapy groups, then check out this video next.